Tonight, we're getting some possible numbers on the possible future of the coronavirus.
UNMC presented them to legislators today. Some of the estimates might sound scary, but that's if people aren't taking precautions to stop it from spreading. KETV News Watch 7 Sarah Feely is at UNMC tonight to break it all down. Sarah?
Hospitals say the majority of the COVID-19 cases will be mild, so much so you might not even know you have it. But that's a problem if you encounter a vulnerable person and pass that virus on. So they're urging caution and warning lawmakers.
Things are going to ramp up. I think that's a well-known fact given this virus. There's a lot we don't know yet.
Hospitals say prepare for disease burden roughly 10 times severe flu season. But those numbers aren't set in stone.
It says at the very top of that slide that these are our best guesstimates.
Shelley Schwedhelm with Nebraska Medicine says the hospital offered Nebraska lawmakers a prediction of the COVID-19 numbers by looking at other countries.
We then have to sort of take from their learnings, which is early, and what experiences they're having, and then apply it to our population and what we think might happen.
The statistics predict 96 million cases in the United States. 1.9 million of those could require admission into the intensive care unit, many of those elderly or with underlying health issues. They estimate 480,000 deaths. That's if nothing is done to stop the spread.
I don't think panic's ever good. You know, a good plan's really what you need.
The hospital's planning for that increase in patients, but it's hard to predict exactly how many there will be.
Some people have very mild symptoms, so therefore they may not even really feel too sick. So, you know, when that's happening and you're spreading it through droplets, it's gonna spread.
They encourage people to stay out of crowds, wash your hands, and stay home if you're sick. Schwedhelm says they're calling it a pandemic and asking people to prepare.
Can we start to really encourage people to social distance, not attend large gatherings, things like that? And there's a lot of people among the state leaders already talking about that.
Nebraska Medicine says the infection rate for COVID-19 is slightly higher than influenza. They say community leaders, along with the hospitals, are doing risk assessments and putting plans in place for when the virus spreads. Reporting live at Nebraska Medicine, Sarah Feely, KETV, News Watch 7.